And our next presenter is still another pioneer. Mari Kool is our very first person to be earning a graduate diploma in health, and she was working with me on the paper, but because she worked really well with all of our bachelor's students, and I really enjoyed working with her. And because she is neither bachelor's degree nor master's of public health, we're going to give her 7.5 minutes, or maybe even 10. So Mari, thank you.
Lynn. Can you all hear me? Yeah? Okay, so as Lynn stated, my name is Mari Kool, and I am the lone graduate student in the, graduate diploma student in the MPH program. And my presentation is Bridging the Gap, an environmental scan of pre- and postnatal programs in the Capital Regional District. So, my presentation will cover a brief overview of my Practicum organization, my case study, my literature review, environmental finding, scan findings, and my recommendations. I completed my practicum with the Success by 6 Southern Vancouver Island, which is a great organization that works within the region to promote healthy early childhood development. Success by 6 Southern Vancouver Island has 3 main objectives: build community capacity that supports an accessible and comprehensive range of services and programs to support young children and their families, raise public support and awareness to promote the importance of early childhood development, and to influence public policy at both a local and provincial level in an effort to benefit young children and their families. So within my practicum, I conducted a literature review, which I will cover in just a moment. And I conducted an environmental scan of pre- and postnatal programs within the CRD. I should clarify that for the postnatal programs, I was looking specifically at programs for babies under 12 months and under. I evaluated these programs based on 5 main components: their location, their cost, whether they were targeted or universal, registered or drop-in, and their primary function. For primary function, I categorized them into 5 groups: support for new parents, so for example, public health nurse-led programs, connections between new parents and opportunities to expand social networks, education regarding pre- or postnatal issues, health literacy, and health from a purely medical standpoint. With this information, I was able to assess where gaps exist in the current programming. And furthermore, I was able to create a report that will be used to advocate for comprehensive, integrative, and accessible pre- and postnatal programming within the region. Finally, this information was compiled into a geographic information system that will be available to service providers, service users, and other organizations that wish to locate specific programs and assess them based on the 5 previously mentioned components. I will very briefly go over the literature review I conducted to provide a bit of background on why this is an important area for public health. And I'll keep it very brief because it could take up all the time. Healthy infant attachment is an important foundation for healthy early childhood development, which has long-lasting effects not only for the individual, but regionally, provincially, and nationally. Supporting mothers during pregnancy is an important means of promoting healthy infant attachment. And one way to do this is through prenatal education. Prenatal education can decrease fear and anxiety in new mothers and provides important opportunities for new parents to expand their social networks with other new parents, which they may not have another opportunity to do so. And finally, prenatal education is an important means of increasing confidence in expectant parents, which is a great way to promote healthy infant attachment. Postnatal support helps parents through the huge transition into parenthood, and through this support is found to increase confidence and satisfaction of new parents. And once again, it's a great opportunity for parents to gain information and expand their social network. Postpartum depression, which affects approximately 1 in 8 new mothers, is not often as visible as it should be. To put this in perspective, in 2012, 3,126 babies were born in the CRD. So that means that approximately 390 women experience postpartum depression during this time period. And mothers experiencing postpartum depression demonstrate a natural desire to connect with other women for symptom normalization, showing a clear need for postpartum depression support groups. So my findings. The findings from my environmental scan demonstrated a clear lack of integrated, accessible, and comprehensive pre- and postnatal programming. This was particularly evident in prenatal education. In the CRD, only private cost-based classes or targeted classes exist, which reveals a lost population that may not be able to afford the cost-based classes, but also may not fit the criteria for the targeted programs, leaving them with ultimately no options for prenatal education. The environmental scan also revealed inconsistent distribution of postnatal programs and funding. This was interesting to look at through a political lens, as the low level of funding seemingly reflects the low level of governmental interest in the pre- and postnatal population. This isn't totally surprising, as our current provincial government embodies a rather strong neoliberal ideology, which removes the responsibility of family health from being that of the state to that of the family. Doing so despite the fact that even Canada's Chief Public Health Officer states that the best investment a country can make is in the early years. And finally, only 4 postpartum depression support groups exist in the CRD, which, if you recall the statistics from a few moments ago, these 4 groups have to serve approximately 390 women a year. So I made quite a few recommendations because, as Victoria explained, it was kind of a big project to bite off, and in my short amount of time, my practicum, I was really just able to get the first steps going. So my recommendations are, first, to complete a community needs assessment for pre- and postnatal programs. What are the needs of the communities? How are the current programs meeting those needs? And what more is necessary? Second, to conduct a specific needs assessment for postpartum depression support groups. Are the 4 current groups meeting the needs of the region? Third, further evaluate funding for these programs, as currently it is so scattered and inconsistent. Fourth, create a detailed map of birth rates in the region that could be integrated into the geographic information system, so a comparison can be made in specific areas between rates of birth and program availability. And finally, conduct an investigation of regional funding and provision of pre- and postnatal programs, both in BC and across Canada, to help gain understanding of how other regions provide the programs and services to their communities. That's it. Thank you. I really want to thank my cohort and the faculty, and Victoria and Betty for helping me with this, get this practicum going, and Lynn for her support in the course. And yeah, thank you. Any questions?
Any questions or comments for our intrepid diploma student? Yeah.
Thank you. That was great. Mary, 2 questions. In regards to the prenatal education, you said they were all cost. Are there any of these programs that have any kind of that they will waive the fees if somebody just cannot afford it?
The only program that I came across is through the Souk Family Resource Center.
Okay.
That they have a cost, but they'll do it on a sliding scale. Okay. Otherwise, they're all quite costly, like around $170. So the rest of them are all either targeted, for specific populations,
Yes.
or cost-based.
Okay, and those would probably be at no cost. I'm thinking
The targeted
of
ones
the
are at no
Intercultural
cost.
Association, etc.
Yeah.
And the other question I had was about the postpartum depression support groups, and just wondering if you came across much in the way of the stigma that still seems to be attached.
Yeah, I did in my literature review. That was a big part of it, that it's a pretty widely unrecognized issue right now, and that depression itself is, has a lot of stigma, and being a new mother, when you're supposed to feel happy and blissful, if you're feeling miserable and, don't like your baby, then it's pretty hard to face that. Thank you.
Was there a question?
Yeah, I'm going to make my way.
Oh, okay. Sorry, Phil.
Mari, awesome job. You did a really good job of very clearly stating what you did, and I know you had amazing support from your practicum supervisors as well. I just want to say how great it is that you're getting the GIS connection in, and I can't wait to see it.
Yeah, it's still
So this is
getting
such an
going.
important area of public health that we need to explore much more often. This is a wonderful opportunity. You presented a terrific project to practice that and to get a sense of how GIS can be integrated into public health work. And so it's very exciting. Thank you.
Thank you. And I forgot to thank my Practicum supervisors who couldn't make it today, but they were Jan White and Colleen Hobson. They're amazing.
Hi, thanks for your presentation, Mari. I'm wondering if you found any particular patterns in the gaps of service, or if there were any particular cases that kind of made your blood boil where you thought, these people should have this service.
Yeah, the prenatal education piece was probably where it made my blood boil the most, just because personally I got pregnant with my first son when I was 25 and I was finishing my bachelor's degree, and I didn't have the money to pay for that, but I definitely didn't fit into any of the real targeted criteria. I was, educated and just the specific criteria, so that for me, especially because none of my friends were having kids, and so to not have anywhere to kind of have that social network and that support that can really help you through the transition. So that was probably the area that I found the most frustrating. And also I found that for the targeted, and there's so many programs I won't go into, but for the targeted programs, there were clustered in kind of funny ways. So some areas like the West Shore, which has probably has the second highest rate of new babies being born in the region, has very few programs. So that was kind of frustrating, that this area where there's lots of parents and Souk, that kind of area where transportation issues might be, really hard for some new parents to not have accessible programs. Thank you. Sorry, I don't know
Hi,
if I
that was
answered it.
great. Just a quick question. In your lit review, did you find anywhere where it was working really well? Like, I'd just be interested to know if there's other countries that are doing this really well.
No, and that I didn't get to that in my lit review, which was one of my recommendations, was that I think that would be really valuable, because I'm sure, I feel that there's got to be countries or regions that are doing this really well, so that I think would be a great next step for this project, which is being moved forward through Success by 6. So, yeah, thank you.
Thank you.
Thank you.